Hey everyone, it's Dr. Wood, and today we're going to be covering Chapter 21, where we talk about some eye and ear disorders. Now, this is a very common reason for patients to show up for at the ER, urgent cares, things like that. And so just a few definitions to define here. So when we say meiosis, that basically means we're having a constriction of the pupil. It should be getting quite small. The opposite of which is going to be mydriasis, where we actually have dilation of the pupil and it should get pretty wide there. We'll find there's many medications that can cause either of these two conditions here. Something else that goes along with that is called accommodation, and this is where the lens of the eye actually changes shape to allow for viewing of either things that are very close or things that are very far. Depending upon your lens and how well it can accommodate, this is where you have things like farsightedness and nearsightedness come up. And again, this is another thing that medications can potentially affect. One thing that we might all come to or succumb to at some point is called presbyopia. And this is basically where as the lens gets older, it tends to become more rigid and is less able to accommodate. And so this is where we see some of the eyesight that fails due to the aging process called presbyopia. When you say cataracts, that typically means that the lens has become quite cloudy, which can obscure the vision. So it's a common reason for blindness, especially in the elderly. The term cycloplegia, which basically means the paralysis of the ciliary muscle. Typically, that muscle is necessary to cause meiosis. So if you paralyze that muscle through either medication or some other means, that will then cause mydriasis. And that will actually become important later when we talk about some of our eye exams. And then glaucoma is going to be increased intraocular pressure. There's a couple of reasons for this, which we'll get into a little bit later, but this is another chronic reason why patients may become blind over time, just due to increased pressure in the eye. Typically causes increased pressure on the ocular nerve, which eventually leads to decreased activity and blindness. So, as I mentioned, eye and ear complaints are a really common reason for patients to show up in the urgent cares and ERs and things like that. Reasons why patients might show up with eye symptoms could include things like maybe their vision is a bit disturbed, or maybe they're having eye redness. More common than not, a lot of it has to do with things like pain and burning, itching around the eyeball. A lot of infectious reasons for patients to show up with eye complaints. On the ear side, this is where you're going to see the common complaints include things like vertigo and dizziness. You'll find that the ear not only is useful for the sense of hearing, but is also really important in terms of your sense of balance and sort of accommodating for motion and things like that. And so if you have any kind of sort of disruption there, maybe due to infection or inflammation, things like vertigo tend to happen. So we'll talk about that later. Tinnitus is a common thing where you have like ringing in the ears or maybe like a muffled sense of hearing. Another big reason. Some medications can actually cause that. And then you'll find that earache is a very, very common cause for people showing up, particularly kids who tend to be more prone to things like otitis medias and whatnot. So starting off with the eye medications, you're going to find that ophthalmic medications are going to be formulated just for the eye, and that is really the only place they should ever be put. The reason for that is that the eye is pretty delicate in terms of what it can tolerate, in terms of pH and tonicity and things like that. Also sterility, because the eye is really not as protected as, say, for instance, the skin in terms of fighting off infections. It's important to understand that not only can systemically administer medications, say either via PO or IV routes, they can actually cause ocular side effects. We'll talk about a few of those. And then similarly, eye medications, you may think, well, you're just putting them in the eye. What kind of big effects can you see there? They can actually cause systemic effects. They can cause changes in heart rate and things like that due to the fact that they can be absorbed systemically from the eye. Also very important to note that eye preparation should remain sterile. This is a big reason for patients to get reinfected with, say, a virus or a bacteria because they don't keep the eye preparation sterile, or maybe they share them with somebody. That's a big reason for spread of those infectious diseases. Here's a couple of cases of eye medications, or medications I should say, that can cause ocular side effects. So for instance, you think about your opioids like morphine and heroin, very typically cause meiosis. It's a very common thing we would see in patients who maybe have overdosed. Things like ethyl alcohol. So if you ever know anyone, not that any of you would ever do this, but if you ever go out drinking alcohol, that can cause things like nystagmus. And maybe that's something that, say for instance, you get pulled over while intoxicated, that actually police officers will look for to see if you're having any abnormal movements of the eye that could be induced by ethyl alcohol. So a lot of reasons for patients to have ocular side effects, even though the medications may have been taken either systemically via the oral or IV route. Now, on the flip side, if you have ophthalmic medications causing systemic side effects, there's a few of these, but they're important to note. So, for instance, a lot of the anti-glaucoma meds can do this. So, for instance, I'll focus on the beta-blocking agents. Now, beta-blocking agents, while very good for helping to lower intraocular pressure for glaucoma's sake, when it gets absorbed systemically, it can actually cause some pretty significant effects, especially on the heart. Beta blocking agents actually will block beta receptors, which is normally acted on by things like epinephrine, which is released from your sympathetic nervous system, norepinephrine as well. And so if you block those receptors on the heart, you tend to cause a slowdown sort of effect. So you can see things like bradycardia, which is slow heart rate, low blood pressure. You can see things like worsening asthma due to some of the beta receptors in the lungs being affected. And again, that's just from a medication applied directly to the eye. So it's important to understand that even though it is going in the eye, it could cause more systemic sort of effects. So medications, some common medication side effects that you'll see with these ophthalmic meds include things like changes in intraocular pressure, which could be bad if you have glaucoma. Almost all of them may cause burning, stinging, and pain upon administration. And then depending on the formulation you have, you can see things like blurred vision. So for instance, ophthalmic gels tend to cause more blurring of vision as opposed to a solution. Things like that can occur here. In terms of otic medications, we'll talk more about that in more detail later on, but typically you may see some like burning or itching in the ear canal, maybe some dizziness depending on the temperature of the medication, which I'll mention later. But those are common side effects you'll run into. So reasons why a lot of these patients are going to show up in, say, the urgent care, the ER, places like that, are typically going to be due to ocular infections. And here's just a variety of different ocular infections that patients may come in with. And depending on where the inflammation is or where the infection is, it can be called different things. So for instance, if you have blepharitis, that's going to be inflammation of the eyelids, versus things like a chalazion, which is going to be actually a cyst in the eyelid. You'll find that most of them are going to get either treated with anti-infective agents, which we'll talk about, and then also anti-inflammatory agents. Typically, even if a patient shows up with, say, just a unilateral eye infection, so say just one eye is being affected, we'll typically treat both eyes just in order to prevent spread of infection later on. So you'll find that other reasons why we might give anti-infective agents, you'll actually find that most newborns, in fact all newborns that they're born in the hospital, will end up getting some sort of antibiotic drop or ointment in the eye. And that's actually to prevent infection, especially if it's a vaginal delivery, since the baby may be actually picking up bacteria from the vaginal canal. That's to prevent eye infections there. One thing you want to know is that when you're irrigating the eye, you want to make sure you're turning the affected side, or turn to the affected side to prevent cross-contamination, meaning if I was saying irrigating the left eye, my head was facing up, I would want to face to the left to make sure I don't have anything that could cross-contaminate over to the right eye. And then you're going to see that our ophthalmic corticosteroids, we've mentioned steroids before and some of the systemic effects they can have. They actually find that ophthalmically administered ones can have systemic effects as well, things like hyperglycemia, fluid retention, etc. So, as we mentioned, glaucoma is typically characterized by intraocular pressures that are increased above normal. There's two varieties you'll have there. There's what we call closed angle and then open angle glaucoma. Majority of the medications we have actually treat open angle glaucoma. This is a chronic condition that can cause blindness over the course of, say, years to decades. A closed angle glaucoma is typically like a really acute, very painful sort of thing that is typically requires immediate surgery, whereas open angle glaucoma, as we said, is a chronic condition we can treat over the course of years. Some of the agents we're going to use here include things like beta blockers. So I mentioned Beta-Optic and Ocupress. We also have things that mimic the actions of prostaglandins, which are natural substances that our body produces. We have things like Xalatan and Rescula. We'll have some agents that actually work to dilate the pupil. They're called sympathomimetic agents, meaning they act like the actual epinephrine and norepinephrine that our body produces from the sympathetic nervous system. Propine's one example of that. And then we'll also have other agents like carbonic anhydrase inhibitors or cholinergic agents. Ultimately, the goal here is to either decrease the amount of aqueous humor that is being produced in the eye, so less fluid means less pressure. And again, aqueous humor is no laughing matter for any of you thinking so. Or the other thing you can actually do is try to increase the outflow of fluid. So trying to get more fluid out of the eye will also decrease the pressure. So for instance, beta blockers actually will stop production of aqueous humor, or at least slow it down. Prostaglandins actually increase the outflow. And so you'll find some patients require 2 or 3 of these agents working together in order to get better synergy. So here's just a list of the different medications you're going to run into, typical dosing and side effects, whatnot. Remember, a lot of these ones used for glaucoma can actually lead to systemic side effects. So it's important to counsel patients about that to make sure that they are aware and they will kind of know what to expect whenever they get those medications. So moving on, another class of drugs here called Mydriatics and Cyclopegics. Mydriatics, as you might suspect, means it's going to cause dilation of the pupil. You're going to find the Cyclopegics are going to be things that will sort of, as we mentioned, paralyze the ciliary muscle. It's going to cause mydriasis as well. So there's different ways you can do that, one of which could be, for instance, a adrenergic agonist, which can act like the sympathetic nervous system to dilate the eye. That's one way to do it. Or you can, for instance, do things like block muscarinic acetylcholine receptors, and you can cause a cycloplegic sort of effect there. Now, for the most part, over-the-counter adrenergic agonists, things like, say, for instance, tetrahydrozoline and nefazoline, they actually are used typically for red eye. The reason why we use those is due to vasoconstriction. By constricting those blood vessels, you can also end up decreasing a lot of the hyperemia or the eye redness you can see there. As we mentioned, the anticholinergic agents are really used for those dilations as well. So kind of 2 different ways you can end up getting the pupils to dilate, which is important because if you need to do certain types of exams, you need those pupils dilated in order to get a better view into the eye. So different drugs we have here, including things like atropine, cyclopentolate, which is a very common one we use in the hospital setting. I frequently use phenylephrine pretty commonly in the ER in order to dilate the eyes, in order to look for certain types of exams that we can do there. Common ones you'll find over the counter include things like nefazoline and tetrahydrozoline. Those are typically in products like Visine that can help with eye redness. Now, we can also use anesthetic agents, and so this is really helpful for things like tonometry, where you're testing actually the intraocular pressure. Say if a patient came to the ER and they have something in their eye, you can also help to numb up the eye in order to try to get rid of that foreign body, or potentially if you have to do any suturing there. So the goal is to numb the eye such that the patient doesn't feel anything that's going on and prevents them from sort of blinking too much and causing an issue with your exam, or trying to fidget away. Those are very helpful agents there. A couple ones we have include things like tetracaine and proparacaine. Now, the patient, especially if they're coming in, they're having a lot of eye discomfort, they're going to feel better whenever they have these agents here, but it's really important that we don't send them home with an anesthetic, and the reason for that is because when you administer these drugs, you don't have the blink reflex. You won't really notice your eyes drying out. That normally triggers a blink. And so when that happens, the eye tends to dry out, and that can actually lead to more things like corneal abrasions and other injuries. And so you never want to send these out. These are only going to be used in the office. Other things we can do include things like artificial tears and lubricants. Typically, this is going to be for patients who have, say, decreased tear production for whatever reason. They can do things that help them to moisten contact lenses. They can help to remove debris from the eye. Typically, these are going to be things that will mimic the effects of, say, like normal saline, or things that are isotonic to the eye itself. And so you have things like Lacrocert, Lacrolube, Tearsol, things like that. In some cases, you may actually have certain drugs called immunomodulators that can actually help, especially patients who have like an autoimmune condition where their body is sort of in overdrive in terms of inflammation, and it can actually help to tamp that down, to decrease that inflammation, and that can help to stimulate tear production as well. We have a lot of patients who will show up who have seasonal allergies that will present with a lot of hyperemia and tearing and things like that. And so we do have things that are good for allergic conditions to help prevent the itching and the redness and the discharge. Just note, them in themselves can cause stinging and burning, so you have to really find the right drug that works for your patient. We have things like ketotifen, which is over the counter. We have olopatadine, several agents here that are useful to help decrease those seasonal allergy sort of symptoms. Or it may not be seasonal, it could be year-round, depending if the patient is, say, for instance, around an animal that happens to stimulate their allergies. Anything like that could potentially do it. Getting into ophthalmic staining agents, there's one product here we call fluorescein, and fluorescein is actually a very useful agent in the ER. If you have a patient who comes up complaining of eye pain, typically one of the things we want to do is look for corneal abrasions, which can be very difficult to see with the naked eye of itself. But if you use fluorescein, you can actually stain the eye, and then by using what they call a Woods lamp, you can then basically light up that stain, and you can look for anywhere where the actual drug accumulates here. So here would be an example of a corneal abrasion in this patient's eye. Again, may cause a little bit of stinging. We will normally give this along with an ocular anesthetic like a tetracaine in order to help decrease some of the irritation you see with that, right? So again, very often we're going to be doing this for looking for corneal abrasions, corneal ulcers, and things like that. Now, moving into the ear, you're going to see that the ear is obviously very important for hearing, but it's also really important for equilibrium, right? So if you were to look at the semicircular canals and all of that in the vestibule, all that's really important for helping with the sense of movement and keeping our balance and things like that. And so you can find disorders anywhere between the external ear, the middle ear, or the inner ear, as it turns out. Now, typical reasons why patients will show up to the clinic or the ER for ear complaints include things like earwax accumulation. Another name for earwax is cerumen that can build up in the ear canal. Things like furuncles that can come about from infected hair follicles, inflammation. Otitis media is a very frequent cause for kids coming into the ER. This is basically a middle ear infection. And then it could be for things like tympanic membrane perforation. We have a lot of different otic preparations that are available to us, including things like drying agents, anti-infective agents, corticosteroids, which can be applied directly into the ear canal that can help to decrease swelling and inflammation, and even drugs called cerumenolytics that will actually help to soften up hardened cerumen and can help to irrigate that out and get rid of that blockage there so that patients can hear a little better. Important for otic preparations due to sort of the changes in terms of the anatomy of the patient. For kids, you typically want to pull their ear down when you're administering otic medications. For adults, you want to actually pull up and back. And what that does is actually help to make a little bit better pathway into the ear itself and allows your medications to flow a little better. Important to make sure not to occlude the external ear with any kind of tight-fitting plugs, since that can lead to rupture. More often than not, we'll end up using things like cotton plugs. One thing you do want to know is you don't want to instill cold medications into the ear by actually applying cold things right there against the tympanic membrane. That can actually cause some vestibular disturbances and make your patient very vertiginous. They experience vertigo, they get very dizzy and maybe nauseous and want to throw up. So warm them to room temperature, usually by rubbing them between the hands or just leaving out for a period of time. It's important to note that sometimes we'll actually use ophthalmic medications in the ear. That's really no problem to make that shift there, but we don't want to use otic medications in the eye, mainly because they're not really formulated for that and they will cause severe irritation to the eye. Now, in terms of vertigo and toxicity, you're going to find that typically this is caused by effects on the cranial nerve number 8, which is really important for both hearing and also for the balance. And so you're going to see that tinnitus is a very common sign of this. So basically they'll complain of either muffled hearing or ringing in the ears. And you can find that it will lead to things like severe headache, nausea, vomiting is quite common, and then basically difficulty sort of balancing. And it actually looks very similar to something called Meniere's disease, which is another reason why patients will show up feeling very vertiginous and like they're going to tip over at any point, very nauseous, things like that. Now, in terms of storage for ear and eye preparations, it's important that because there is a lot of overlap between the two types of medications, a lot of the same medications can be applied both ophthalmically and otically. That's important to keep them separated on your shelves such that they don't get confused. And if you accidentally gave an otic medication ophthalmically, that would be a big problem because you can cause severe irritation. So we don't even keep them stocked anywhere near each other on the shelf, and make sure that it's very difficult to mix up. So that's it for this section. If you have any questions, let me know, and I'll talk to you soon. Thanks a lot. Bye.